Hello, everyone.
Hey, good morning.
Morning.
Morning, everybody. Happy Friday. Happy Friday.
Welcome to the Proactive Health Collective of Keene,
Woohoo!
covering all kinds of cool stuff, current events, health topics, and just fun stuff.
Yeah. Yes. We were just talking about the holidays coming up. We're all getting excited about that. The holiday season is feeling rather festive, and hope everyone out there is as well.
Yeah, there's a bit of a mixed bag, I think, with the holidays, like some concerns about how many people can come over for Thanksgiving,
goodness.
that kind of stuff.
Yeah, well, just forget those concerns and do what you want.
Yeah, that's...
It's like, really, who's paying attention to that? Did you guys see the meme? Did you see the meme that has a picture of a turkey and it says 6 people for Thanksgiving, 30 people for a funeral. On November 26th, we'll be celebrating the death of our pet turkey that died on the 26th, refreshments included, provided.
But holidays is a really interesting thing because it is, it can be such a great time, for a gathering and, sort of taking stock in, things that are other than our busy lives and all the stuff that we have to do and take care of and all the doings. And it's just a time that we can come together, but it also is a very stressful time for a lot of people, for various reasons, some financial, some, you have the family dynamics that can be stressful for a lot of people come in. So it's kind of like everything. There's 2 sides to every coin, but it seems like things in the holidays can be amplified a little bit, both on a good and a challenging side as well.
Yeah. And then throw in the lack of sunlight there. I feel like the holidays are kind of a nice thing because when it starts to get darker, you can look forward to the holidays. But Becky, you wrote a nice thing about like seasonal affective disorder, some things you can do for that.
Yeah, that's really something that affects a lot of people. I'm glad it doesn't me because I love like the gloomy days and stuff. They just make me feel really, it's almost like music in a minor key. I just kind of like that. But yeah, but the thing is, it's really true. And seasonal affective disorder starts like in August. It's, people start talking about it in February when it's reached its kind of peak. And that's way too late. So yeah, there's certain things people can be doing to really help themselves deal with that, because it differentiates itself from other forms of depression in that it's characterized by a lack of motivation. It's almost like a semi-hibernation. And so people who normally have great ideas, they're brilliant, they have great ideas, they're go-getters. It's like, I can't get off the couch. I just cannot even raise the interest in doing things that normally I would be thrilled to do. And so it's difficult. Yeah.
Yeah. Perhaps it's a time, obviously this year is probably going to be really different for a lot of people. I know it is for us because of travel and just the concerns with everything like around that and what we can and cannot do and how everything is being affected, but still sitting and focusing, especially, like Thanksgiving for sure, because Thanksgiving being what are we grateful for and really focusing on what is good, because no matter what happens on the outside and in the external world, whether it's, a crazy pandemic or political or whatever it might be that is stressing us all out, or the changing of the seasons, it's really still continuing to focus on what you have and what is good. Because like we always say in our office, like you can always focus on what's wrong and you're just going to get more of what's wrong, but if you really change your mindset, and I know we've talked about this in the past, but if you really change your mindset and really focus on what's right. I've had a plethora of new patients that I've had to say this to, be like, what's good today? Tell me something great that happened. And some people are like, oh, I have to think about it. And I'm like, okay, I'll ask you at the end of your session. And usually by the end of the session, they can come up with something. Oh yeah. And some people are like, I'm here. Thank goodness I'm here, just doing something good for themselves. But I think gratitude especially this year, is going to play a huge role in getting through the holidays with a more positive light.
Yeah.
And that's kind of I think I live with gratitude like all the time. I'm always like, oh my goodness, I'll turn my computer on and I'm like, oh, thank you, God. My this computer works. This is great. You know, I do. I just am that way. I'm like, oh, I love watching the birds, and I'm not patting myself on the back, but I that's just the way I am. And I do think that that is super helpful, because it does keep your focus super balanced, because there's a lot of things that concern me very, very deeply. I mean, you know, what's happening in our world and our lack of the push for taking away all our medical freedoms, and the fact that people just tell us what we can and can't do, like whether it's travel or whatever, and people just say, okay, well, just tell us the next thing we can't do, and I guess that's what we can't do. And that even just that people think that way and are that obedient really, really bothers me. But I can't think about that all the time, right? We can't think about those things all the time. We have to dedicate time and prayer to it, and making the effort we can to, you know, our Rise Up New Hampshire group we just started, go to riseupnh.org and check us out, trying to really put forth different scientific information to counter the pandemic narrative that just keeps coming down from the so-called trusted experts. And so we need to empower ourselves, and we need to speak out. We need to be writing letters to the editor. We need to be, you know, I do on my radio show, but we can't be consumed by things. We have to live in balance, and we have to, you know, maintain our own health ourselves, or we're of no help to anybody else if we don't do that.
Yeah.
That's one thing.
I want to say this. We have people on our webinar. To those who are on the webinar, we want to encourage you to go in and comment. If you want us to talk about something or whatever, please feel free to do that. You just go to the Q&A and we'll see it and we'll address that. And also, we'd love to hear what kind of topics you'd like to hear us to talk about in the future. Right, gang?
Absolutely. You know, one of the things, and Tisha was kind of touching on this, I think that universal law is like whatever you focus your attention on expands. And, you know, again, if you are focusing your attention on everything that's bad, you can expect more of that. And there's a balance there, like you were saying, Becky, in that, I don't know, I look at it like, you know, when we have a disease process in our body, I think of things like, you know, universal sort of principles. And sometimes it takes a symptom in your body to become bad enough or to become prevalent enough for you to act, for you to do something. And so when you think about, you know, what you were just speaking about, Becky, with, you know, all this stuff happening, we sort of we're in a lull, like, hey, we'll just do whatever we're told, and we kind of go. And sometimes it takes kind of, you know, getting a little uncomfortable and realizing, wait a second, this isn't, you know, this is really an uncomfortable thing, and it takes that to wake up, to be able to take some action and do something different. I think that's something that happens in our body, you know, from our physical symptoms that we experience, and realizing, okay, I can't keep doing what I'm doing. This isn't really working, and sometimes this happens, you know, on a social level. I mean,
Yeah.
Sometimes this always happens on a social level as well. So.
Having gratitude practice is something that I always come back to if life gets difficult or you just get stressed out. And one of the things I love is just jotting down 5 things a day that you're grateful for. It doesn't take much time, but after a few days or a week, because they have to be different things every day. And then you realize that you have to start really thinking about it. And then because you're like, you know that you have to do it the next day, you're training your mind to look and scan your surroundings for things that you're thankful for all the time. And then it really changes your mindset. And there's been a lot of like research on that I've heard as well. But it really works well. And I think they say it takes like 21 days or 28 days to create a habit. So if you do that every single day without skipping a day, it can really shift how you're interpreting your life. And you start to really feel grateful instead of trying to feel grateful. You start to actually really feel that.
and making it important that you feel grateful when you feel grateful. It doesn't have to be just in a stressful time. It can be like even more so when you're feeling awesome. You wake up and this warm season, like this just unseasonably warm weather that we've recently had, I woke up and I was like, oh my gosh, I am so grateful for warmth. I'm grateful for a warm bed. I'm grateful for a warm house. And I was nice and warm and, just like, oh, thank you. Just being in the state of gratitude, even if it's not stressful, but obviously more importantly, when we are stressed, and still find the good in things. So great point, Allison.
Yeah,
I
and
think,
oh, go ahead.
I was going to say, piggybacking on that is that what I've seen, in many years of practice is that people tend to try to put in place their stress relieving practices when they're at the peak of stress. And the key really is to put in place those practices while you're not there so that they become a resource for when those times do come. Because when you're in that total stress, it's really hard to then get into gratitude and have whatever routine. But if you can, like Allison was saying, if you can create your routine all the time and have it there, then it becomes a base, a platform upon which then you have a resource for when those stressful times are coming. They always do, right? For all of us. But it's a lot of my mentors talk about that. It's like having a morning routine, whatever it is for you, starting, maybe it's visualization, maybe it's meditation, maybe it's breathing, maybe it's going for a walk, whatever it is that you create and you start your day off from that place. So you're coming into your day with energy, with vibrancy, with clarity, with intention, versus just like falling into the day and then, being bombarded with all this stuff that has to happen. And and then it becomes more difficult to really to change that afterwards.
Yeah,
Becky, what
and
do you want to say?
I want to say that what Allison was saying, I think that's a good exercise if you tend not to be grateful, but it's almost like I would never need to do that, because this is just, it's almost like in the Bible, Paul talks about praying without ceasing. So if you're not used to praying, you might say, I'm going to set aside a certain time to pray, right? But if you're used to having a constant dialogue with God back and forth, you don't have to do that. You're just constantly bugging him
It's your
with your
program.
chatter. You're just constantly doing it. Okay. So it's the same thing with gratitude. It becomes who you are. So rather than something you do. And I think, and then it's not, but I think doing an exercise like what Allison said is a great way, especially for people who tend to be more the Eeyores, rather than the Tiggers, it's kind of that Eeyore, nothing's right, that kind of thing.
Yeah.
I think
get to that place,
Yeah.
I think that I kind of apply that to what I call being present, and so people will take time to meditate, and you could kind of, the lines get sort of blurred between meditation, prayer. They're kind of the same thing, really, depending on how you look at it. But in making everything you do like a working meditation, in other words, if you can be present, totally present with whatever you're working on, with the person you're being with at that time, to be there and not be somewhere else. And then even, like getting into the car and closing the door and feeling it close and putting your hand on the steering wheel, and everything that you go through life, if you can totally be present and be aware, then again, that's like, it becomes, like you said, Becky, part of you, where you're not like having to work, oh, let me spend some time that I have to work on being present, because you're doing it all the time. And not that those things aren't valuable, especially if you do have a lot of momentum against you, to take some time to kind of slow down the train, and meditate or pray or whatever it is your practice is, to do. But yeah, ultimately you want it to become part of your regular being.
Mm-hmm.
That reminds me of people, like when people come in, say they're getting a course of treatment for their pain, and then their pain gets better. So they say at the end, all right, I'm good, I don't need to come in. And you're like, okay, but you know that if you do come in when you don't have pain, you're just gonna feel, it's gonna take you to the next level. Like your body's gonna help in other ways, and also your pain won't come, it's not as likely to come back. So it's like, you don't have to be sick in order to get a treatment. You can feel great and get a treatment, and it's gonna be like it'll keep you there. And
Yeah. And then
Yeah.
you won't need a treatment because you're sick, because you had treatment when you weren't sick.
Yeah.
And you didn't get sick, you know?
Yeah.
Well, that comes from the Western model of, the Western model of medicine, which is get sick, treat things. Really, with all of the things that each of the practitioners that are on here, what we do is proactive or should be proactive. And, you could wait until, you have these symptoms and you're getting sick, and then that's the only time you do something about it. You're in the Western model, even if you're using a more holistic approach, but you don't have to. I mean, and you really, in the end, not only do you save yourself like money and investment, because when people wait, I mean, a lot of people come in our office, they're like, really have let their health slip to the point where, it's a big project, right? And if you could maintain your health before you get there, it's actually so much less that you'd have to put into it. But also, when you think about it, I think of it like this continuum of like, there's not, it's not sick and not sick. There's, as you go, and I'm sure Tisha's like, mind rolling on this, the wellness continuum, as you keep going up this continuum, there's more gifts, there's more benefits that you could get. I think you're alluding to this a little bit too, Allison. It's like, it's not just about whether or not you have this symptom or this pain, but like, are you experiencing the most that you can out of life? Are you as vibrant? Are you at your top vibrancy? Are you contributing as much as you can to your family, to your church, to your organization? Like, that's what wellness really is. And that's what the opportunity that it presents. Yeah, you can use it like, okay, I'm sick and I'm going to go a natural route versus a chemical route, but you're missing out on so much more that's available to you.
Yeah, because health is a progression. I was telling a practice member this the other day, like it ebbs and flows. Like, you're not always going to stay up. You're going to go down a little bit and you'll come back up. And how we, like Jean, you were saying, how we've traditionally treated it is like, oh, I'll just go in waves. And if I maintain this, like, if here's your baseline and you're just kind of like right here, over time, well, the dips will be a little deeper and you won't recover as much, and then they'll go a little bit deeper and you won't recover, and then you like start to have the failing health. Whereas when you're maintaining and doing things on a regular level, the health can actually dip, and the valleys will start, the peaks will start to rise, and the valleys won't be as low, and then the peaks will rise a little bit more and the valleys won't be as low. And so you actually progress in the opposite state. So you're
it's like the stock market,
There you go. It's either you're either in growth or protection. You can't be in both at the same time. And so maintaining good, healthy strategies, including a mindset, a gratitude or grateful mindset is so important with so many things in our life, especially when we're going through super trying times. And no, it's not easy to maintain, and life can get you down. So it's just interesting how we wait. We continually wait until something happens. I had a girl come in and she had a lot of concussions when she played soccer, and now her hip hurts. And this is, I mean, a decade later. And she's like, I don't really know. And I was like, well, what happened when you got the concussion? Did you black out? Did you lose your consciousness? Like, what happened? She goes, no, I just was like starry for a minute, and then I just kept playing. And that's like our typical thing. If you don't have immediate symptoms, oh, well, then you must be fine. And we don't think of the implications of how it plays out 5, 10, 20, 50 years later, as to what it's doing to our internal system. But eventually it's going to show up in some shape, form, or fashion. So why wait? Oh, I don't have a symptom, but maybe I should just at least go get my, my chi balanced, or maybe I should at least get my nervous system checked. And like Jean, the work you do, like when we worked with you, it's like, what's your frequency? Putting it, what do you need right now to support your system? See how the frequency starts to increase, and then you can shift off into something else, because now your body is at a level to be able to handle whatever that was that you were fighting. So you're good. Now your body can recover naturally, and you can focus on something that now needs to be focused on, like getting the underlying issues in control so that your body can maintain it, and handle it on its own. Right.
Yeah. And you're also talking, before you were talking about, it's really like what, the ups and the downs, but you have a baseline, right?
Mm-hmm.
And if we're just trying to get past the symptoms, your baseline will actually drop over time. And and I know all of us have had these people come in. It's like, well, I'm okay if I can just, like, we lower our what we think is possible.
Oh,
We lower what we think is possible for us. People will say, well, I'm 100 pounds overweight, but I'd be okay if I was just 50 pounds overweight. That I'm good with that. I've lowered my standard for what I'm willing to accept for my well-being, my wellness. And that's just one example, but as we sort of flirt in that area of just barely getting above, where we can breathe, over time, that baseline is going to drop, and we drop our standards, and we drop what we think is that we're entitled to, and that's available to us. And that's really the sad part, is because that becomes part of the mindset of like, well, I could never have this because this is where I'm at. And again, if you can get past those major symptoms maybe, and then continue on the path, now you can raise your baseline to where you're I don't want to say expectations, because I think you can have a mindset to accept in some ways where you're at, without making it a negative, like, oh, I'm here and I shouldn't be here. But the ability to continue to reach new heights in your physical and mental and emotional well-being, I think is
I think
it's always focusing on what you want. What do you want?
And I think what you're saying, Jean, too, is like, okay, you can be content. Okay, I don't have to be, the perfect size 6 or whatever before I can be happy. That's not the point. The point is, we always say you have so much more power than you think you do. And so people cannot realize the extent to which they can improve their health, and just think, well, I'm too old. I should have done this when I was younger, or I should have, it's too late for me now, or those kinds of things. And that's just not true, because the body will respond to what you do with it. And so this is a message of hope, and it's a realistic hope that you can, as much as you want. Don't put a cap on it about what you think is the limit to what you can achieve. And I think that's really empowering to.
Yeah. When weight, because weight, I'm not, I know in my office, and I've been in practice for a long time, top 2 things that people are concerned about: weight and energy. Over all other things, they could have cancer, they could have, diabetes, but weight and energy. And weight, a lot of times having to do with, how we feel about ourselves, our self-esteem, and that kind of stuff. And, in our office, we always talk about, like, well, weight is a symptom like any other symptom, and weight isn't really the problem. And if you focus on just weight, and your objective is just to lose weight, you're generally you might have short-term success, but you generally end up in the same place. That's like Weight Watchers and all that. 98% of the people that do those programs to try to lose weight land up in the same place, and 78% of them land up with more weight, right? Statistically.
Because you're focusing on what you don't want.
Because you're focusing on what you don't want. And it really is, weight is important, and it's not belittling it, but it's a surface thing. Is if we can say, well, weight is telling me that, there are some things that are out of balance in my life. Maybe it's stress levels, maybe it's how I'm eating, maybe it's toxicity, maybe it's my hormones, and usually a combination of all those things. But looking at it that way, it's like, okay, this symptom, weight, is telling me that I need to get myself more in balance. And if we look at it that way, not as the enemy, but as the messenger, then I think we can have a lot more success in moving forward, and not only, getting what we want and feeling how we want and looking how we want, but having that to be a sustainable thing. And again, something that becomes a mode for growth or for bringing ourselves to a new level, in health and wellness, really.
Yeah. And it's interesting, speaking of like what we will and will not put up with. Becky, here's probably a good question for you. This popped up on my chat. I don't know if you guys saw it or not. It said to all panelists, we had a question about, can you talk about the health of people that are wearing masks all the time? Because right now there's a big, concern with what we will and will not put up with. Becky, I know you speak very strongly about this. And she says, lately, I'm noticing it's not just muffled under the mask, but many are congested and stuffy. And she's also really worried about pregnant women who are wearing masks all the time at work. So thought maybe we could touch base on those questions.
You're unleashing a lion here.
Yeah.
Which way do we want to go?
Is that you or me, Jean? Yeah, both of us. But yeah, the masking is very unnatural, both from a psychological standpoint, but also from a health standpoint. We were meant to breathe fresh air. We were meant to exhale and have our carbon dioxide go out into the atmosphere. And we weren't meant to be steaming up, getting steam around our nose and mouth that now can collect bacteria. We're seeing a greater increase in sinus infections and things like that in people wearing masks. It's not healthy. It does impair oxygen intake. I don't have any oxygen issues. I don't have any health issues that stand out to me at all, but I only wear a mask briefly when I go into the co-op, just one of those little thin things. I feel so weird. And it's just like, it's just crazy. And it's not healthy. I would recommend people go to riseupnh.org because we have on there, John Michael DeMay has a whole over 100 page ebook there that you can get for free. And this documents all of these health problems with the masks, as well as a lot of other material. But there's a lot of science behind the masks, and it's been known, research for 40 years has said that it is not healthy for healthy people to be masking. And we also, I just want to say, we have someone here asking to being able to speak. And asking the admin to do that. Dale, can you make that happen for us? I wonder. See this here. Nope, that's the recording. But somebody just popped up and asked if they could speak. So if Dale is there, maybe he can take care of that. I just want to say to whoever that the name of that person was Larissa, and I want to just say, Larissa, would you like to speak? So Dale's working with her. Yeah. Okay. And this
I think there's plenty of evidence, I think, and that is a great resource. John Michael did a great, amazing job, and everything is referenced and everything is links to everything. So it's like all this stuff he put in one place. Just an amazing, amazing job for anybody who's really interested in it. But I think it's going to be interesting as we go. We've sort of had unseasonably warm weather, but as we move into this cooler season and people start having more stuff coming out, which is just, part of the how it happens, it's going to be a lot more interesting, from the standpoint of how much, mucus and snot and,
harboring and growth of bacteria. I mean, and stuff like that. It's just
and I especially think this on the kids, with the kids, because kids, are going to have these masks on all day. Even in like the Waldorf school, we talked about this, that they're going to be spending most of their time outside with a mask on in cold weather. I mean, I don't know if, most of you have probably worn a balaclava, where you cover your face and you're outside, and what happens? It gets full of, moisture and snot and stuff. But also, I just find it interesting, that if you've, again, I think the evidence doesn't support that mask will even stop a virus. But besides from that, if you think it did, it's interesting psychological thing that I see people walking down the street all alone wearing a mask. I just find it really odd.
Yeah.
And
or the big thing in their car.
I want to do this. If Larissa is there, because I think we just got her so she could speak. Larissa, did you want to speak?
She doesn't want to speak. She just had
Oh.
the questions.
Oh, okay. All right. I just wanted to make sure because, yeah, don't want to leave
Yeah.
anybody out. Yeah.
She put in another, sorry, Allison, she put in,
Go ahead.
sorry, she said just unpredictable implications for those babies in utero. And just on that particular topic, I completely understand your concern, because I don't know how many of you out there know, but we are now 5 months pregnant. So I do understand these concerns, and I do not wear a mask all the time. The second I can take it off, I do. Even if I know this may, I don't know, I don't want to start anything, but like, you know, if I go to the bathroom, I take my mask off because I need to breathe. And, you know, my shifts are 2 hours long. And if luckily going to the bathroom is more frequent now. Thank you. And so I do step out and I take a breather, because I don't feel it's healthy for me. And as Becky has already said, like many of the implications that are happening with the buildup, I switch my mask regularly, because I can't bring myself to buying a mask because I find it ridiculous. But I just use the blue thin ones, and I switch them out regularly so that I'm getting a fresh one and I'm not building up the bacteria or whatever, you know, I'm breathing out and breathing it back in. And so I don't know if Becky, if you might know, or Jean, if there's been studies on it, but I doubt it now. But we've already mentioned the implications. But working all day, you have to take breaks. Oh, my phone's about to die.
I'm sure there probably is data there. We could probably find it, probably in the stuff that John Michael has done. But yeah, I mean, it doesn't even take a study. It just is common sense, right?
Yeah. Don't wear it when you don't have to. If you can social distance. You don't have to wear a mask and social distance. That's not the rule, or that's not even the requirement. You can do one or the other, and it's fine. Like if you can separate yourself. You don't have to wear a mask. You know, that they're the guidelines for whatever reason, you know, 6 feet. I don't know where that number came from, but if that's what makes people feel comfortable, then, you know, you have to make a judgment call.
There's no logic to any of this. Okay. So I go into the co-op, and, you know, you're in the produce section, right? So you're picking up tomatoes or whatever, you're examining them. This one's too big, too small, too ripe, or whatever. So you pick them up, you put them down. That's all well and good, but you could do that. You do that. Then I get around and I get over to the bulk section, and I just want to get some walnuts. So I have a little bag under the thing, and I pull the handle down. I'm not touching food at all. And an employee comes up and tells me I need to put gloves on it when I'm in the bulk aisle. And I said, I'm all done. This is all I'm doing. And she goes, well, next time you're shopping bulk, she said, there are gloves on either end. And I said, well, then I will not be shopping bulk. And she said, well, I'm sorry to hear that. But I'm like, where is the common sense? You look at all of the guidelines and they totally defy common sense. You wear a mask in a restaurant while you're walking to your table, then you get with your friends and stuff, you take your mask off, you share food, you do all this stuff, you sit close together, you get up to go to the bathroom, you put your mask on. There's nothing scientific about these guidelines. These guidelines are about control. They are about control and obedience. That's all they accomplish. There's nothing that says staying 6 feet away from somebody does anything. And we don't even know how really communicable this so-called virus is. So it's complete nonsense. It just is. But if you are in a practice like you guys are, where you're like Tisa and Matt and maybe you, Allison, or whatever, where, you know, you're expected, you know, in your industry to wear a mask, then you have to comply. I understand, but it's not helping anybody by doing it.
So a couple of things on, you know, that came to mind. First of all, I posted a sort of a letter from a new mom, you know, with a, you know, infant. And, you know, she brought up the point is like infants, when they're, you know, from day one, they're studying faces, facial expressions. And so, you know, we're talking about, we don't know what's going to happen. Like, how does that affect the development you know, whatever, how many infants have been born in the last several months, and, you know, however this goes on, and people wearing masks all the time, I think that would have a huge impact on the development of these babies and these children. Also, one thing to kind of consider is, you know, like when I buy new clothes, I wash them a couple of times, because when you smell these new clothes, there's chemicals, there's things on them. So I want to get that out before it's on my body, before I'm breathing in, before I'm soaking in my skin. We get these masks, and we just assume that they're totally okay, that there's nothing like that that's going to affect us. Maybe there's, you know, whatever they painted this stuff blue with, the dyes, what's in them? Have we done any research on that? And so we have these things against us, and we're breathing this stuff in all day long. You know, we haven't even you know, nobody's even really looked into that at all. So just something to consider.
Yeah. Some of the things I've seen with patients, acne is a huge one. There's a lot of people that just have tons of acne around their mouth. I had one patient that her lips were peeling and very, very dry and like just red and peeling. There's one woman that I know that gets migraines when she has to wear a mask, and she's really struggling because they give her a hard time at the grocery store, but she gets a migraine every time she puts a mask on.
Yeah.
A gentleman,
those are the outward things, right?
yeah, panic attacks is a common one. I've got people that just, they have to wear the mask and they just like can't, they get a panic attack. A gentleman has like severe fatigue, and it just like he gets home and just passes out, like really, really severe fatigue and trouble breathing. And that correlated with when his company started requiring masks. Those are some of the things that I've seen. I've been mentioning to people, and I'm surprised doTERRA Oils hasn't like come out with this, but like a little drop of eucalyptus oil or something on the inside of your mask. It's been really nice. I do that in the day. I find that the mask makes me tired. When I wear it on all day, I definitely feel more fatigued. You're just not getting as much oxygen.
Now, can I ask you, Allison? I had a treatment with Allison the other day. It was wonderful. I so enjoyed it, but I was face down. So did you, and you know I don't care about a mask. So did you wear a mask when you were treating me?
No comment.
Oh,
No, yeah, yes.
Yes, she did. Yeah, okay. Because I would think it would have been, I'm sorry, I didn't want to put you on the spot there. I forgot. Yeah, okay. I should have asked you that personally.
There's rules. There's rules. You know, I have the times that I have, you know, going into the store or whatever. It's not long before I really feel the effects of it. And I have a history of autoimmune stuff, and I'm just not going to put my body through that. I'm not going to tax my body anymore because it costs me too much, you know?
Yeah.
And, you know, I'm a health practitioner. I've been in practice for 26 years. I understand how the body works. I understand how my body works, more importantly. And I'm certainly not going to have a bureaucrat who has no idea and has no scientific backing to the rules they make. I'm certainly not going to, you know, just blindly follow along with that, because it's a violation. You know, it's a violation of my personal freedom and my health. And you know, just like, and it's interesting too, because the topic has come up because now that a vaccine's almost ready, the thing, you know, it's like, okay, now they're talking about mandatory vaccines, right? Mm-hmm. It's been sort of a nebulous in the far, like, well, maybe someday, but now it's like, okay, here it is. Next couple of months, they're coming out with a vaccine, and is it going to be mandatory? And some people are finally saying, well, I'm not going to do that. Well, principally, you know, why not? You know, if it's okay to violate your health freedom on this level, why is it not okay to violate your health freedom on the next level?
Yeah, it's really true. And I wanted to point out, I just saw this feed from JP Morgan on Wednesday. It says, while the latest vaccine progress news out of Pfizer was welcomed by the market and its CEO, who sold over 60% of his PFE stock on the day of the announcement, right? 5.6 million, I think it was, in a week where global infection resurgence continued with cases jumping 8% worldwide last week, blah, 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 blah. And UE reimposed lockdowns. The UK reimposed lockdowns, considering that approximately 60% of the population will need to be covered by a vaccine. Near-term pressure on infection curve, hospital capacity, growing mortality tally, and stricter public health policies to pull back secondary infection rate below 1 will likely persist for the foreseeable future. However, in a surprising report out of JP Morgan, the bank finds no meaningful curve development differences between countries with and without strong curve intervention. This makes the bank question if existing public health intervention, i.e. lockdown, stricter social distancing, should remain in place next year, and leads JP Morgan to conclude that, quote, public health policy should consider approaches biased towards economic and public mental health over the urge to close the curve in 2021. That's JP Morgan. And, you know, this is the thing. What are we doing? Why are we making the hysterical fear of catching something that's over 99% recoverable the only issue in life? Why is this the only concern today?
You know, it's interesting. I saw a video of the guy who came up with the test, the PCR tests that they use, and
The test.
you know, he's since passed away, but you know, he was talking about how you can't, these tests are not, you can't use them in that way that they're using them, and that's why they are 90% false positive, and all of this stuff that's, you know, these mandates and things are being based on the cases based on 90% false positives.
Yeah.
And, you know, it'd be one thing if it wasn't, like you said, 99.5+% recovery rate for, you know, vast majority of the population. But the amount of other harm that's being done psychologically, mentally, emotionally, economically, in other health things, people, you know, delayed treatment and not being able to get to their doctor and all this kind of stuff, that it just, you know, really defies logic, and it, you know, it kind of brings you to the conclusion of cynicism, you know, like nefarious intentions.
Well, it just goes to show that you don't know the implications. They're not, there's not a long enough, long-term effect yet. So we don't know the implications. We can guess, I know Larissa, you were asking the question, like, what are the unpredictable implications? Well, developmental growth of the baby in utero is definitely, and how that's going to play out, it'll be interesting to find out in a year or so how these children are developing, over time. And it's just something that we don't have data to support. We don't have any knowledge because it's only been 8 months, 9 months, or whatever. We don't know what the implications are, but you can imagine that they can't be the best circumstances ever. So we have to, like Jean's saying, you have to make your choices of what you do a priority over what someone else thinks you should do.
Yeah.
I think one thing that is becoming more of a thing that we're realizing, or that might be correlated, is the COVID long haulers. There's a very growing large population of people that have had COVID, and they didn't die, they didn't need the respirator, maybe they even had mild symptoms of the flu, but they're having like chronic fatigue and a lot of neurological stuff, like tingling and sensations on the skin. And it seems similar to the effects of, we talked about this in the autoimmune webinar that we had, where it's like there's some lines of thinking that it's the autoimmune infections are actually a viral cause, and the body's trying to fight something off and giving you this chronic fatigue and whatnot. But yeah, I think that might be another thing in the mix. Do you guys have any thoughts on that? Why it might be happening, or what you could do to prevent that?
Well, it's kind of like any virus. I mean, if you've had if you've had mononucleosis or something like that, you have Epstein-Barr in your system, you can have reactivated Epstein-Barr. If you have, a Lyme infection, and hopefully if you're lucky enough to get that actually cured, you might have some residual things. But this is not uncommon to many illnesses, and we don't freak out over them because, maybe you had maybe you had rheumatic fever when you were a child, and now you have some heart problems or something like that. I mean, it's unfortunate, but it's not the end of the world. So again, you want to stay clear of getting sick. If you feel like stay away from people who are sick, not just COVID, but anything. But if you do, again, support your body with the greatest health support you can, both dietary, nutritional supplements, and these other practices, and you'll have a better outcome. But we can't say, they're trying to like say, oh my goodness, there's things that are afterwards. But there's always stuff that's afterwards illness. I mean, that's the way many infections always leave people with residual stuff many times for the rest of their lives. And that's the world we live in. And we don't lock ourselves down and segregate. We've never done it before.
What's most frustrating to me with Western medicine and how they approach this all is that there's no talk. In Chinese medicine, you have like phases of the illness, and the first phase is the prevention phase, and it's before you get sick. And there's no talk about what you can do to be more resilient. There's no talk about it because there's no money in it.
Right.
And that's so
Right.
so
And I think the thing here is that, regardless of what it is, whether it's Epstein-Barr or something like that, these things manifest or become prevalent to be measurable when our health is declining. And so when you have all the, people that really have actually died with COVID, and, it's hard to say because of the testing and all that kind of stuff, but they all have according to CDC, 2.6 other chronic disease processes going on. And I think, Alexa, thanks for your comment. She said, respect all of you have to say your feedback on what you think about wearing masks, but respectfully disagree. We should wear masks and do what it might take not to spread this 243,000 people have died. Again, when you start looking at this deeper and you realize that, a hospital gets 20% more, and they list COVID as the death, as the cause of death, you can't really, if you're looking at that objectively, you have to say, well, that could skew your results, right? Because there are people who have died, like in a motorcycle accident, and they test them and they happen to have this COVID show up, which again is a 90% false positive to start with. And then that death gets labeled COVID. There aren't 243, there are not 243,000 people that have died of COVID.
But I hate to say it, but 243 people dying of COVID is really basically nothing, okay? In the US population. Yeah, that's what I mean. Yeah, 243,000 is basically zero, okay? Out of the population of 350 million, 330 million people, it's a very small percentage. So I hate that, but twice that many die every single year by death from medical error, iatrogenic illness. People are dying much more by chronic health illnesses, and we're not doing anything about that. So, people throw that number out and they're not thinking, what is the actual population of the United States? 243,000 due death to, even if they were all COVID deaths, is still 0.07% of our population. And it is not worth shutting everybody down, impairing their mental and physical health, stopping their education, ruining their businesses, stopping normal life as we know it, and impeding worship gatherings and things like that. Just because someone might die, people die every day. Before COVID, 7,500 people die in the United States every single day. And so we've got to look at death in the bigger perspective than just these 243,000 sounds like a lot, but not when you look at the whole pool. It's not.
Yeah, and if you look at overall death in the country, it's not higher. Like if you look at overall death, this year compared to last year, it's not higher. And interestingly enough, all the people that died of flu, there's no flu deaths. They stopped tracking it.
Where are they?
So you have to, if you look at this in a vacuum and you just look at that number, oh my gosh, 243,000 people have died. Yeah, of course that may be concerning, but when you do open up the big picture and you look at all these other aspects, it brings that into question, not only in the amount of deaths that we have from so many other things that are going on that, that the powers that be could be looking at. Why are they not concerned about the chronic health issues? Where's the concern about all those people who not only die, but suffer for 10 or 15 years up until the death? Where's the concern there? Where are the policies? Where, and I don't believe, personally that government should be in control of that. And that's not the job of government. But if that was, they totally dropped the ball, and they're totally dropping the ball in autism. In the rates of autism, they're going, where's the concern? Where's the studies? They don't do that, because the truth is that's not what it's about.
Right.
I mean, if you really look at it objectively, that's not what it's about. It doesn't have really, the powers that be, if they really cared about people's health and people dying, they would have been doing stuff a long time ago, not just this year, based on this one thing that, as you look at it objectively, has been totally skewed. The numbers are skewed. And there's so much evidence of that, and so much people have come forward, people that work in the clinics, the nurses and stuff, saying, wait a second, why is this labeled a COVID death? This shouldn't be a COVID death. I mean, it's all over the place. So I think, it's really, to look at those numbers just on face value, it's really,
Right. And you have to do what is comfortable for you. To make people wrong just because you disagree, and it doesn't matter, you're allowed to disagree. That's the beauty of life. We are totally allowed to do that, and everybody can do it in definitely a respectful manner. Your concern is very valid, and you have to make the choice for you what is most comfortable and what makes you feel the best. If social distancing, which is good, if wearing a mask and washing your hands and everything is which we should wash our hands anyway. I don't know why this is
but not any more than usual. No.
Right. The hand sanitizer I don't agree with, but you have to do what's comfortable for you, and to make other people feel wrong is not going to solve any of this or make anybody feel any better about their choices. So always do what makes you feel the most comfortable, and take the necessary steps to be preventative, because if you have a healthy immune system, if your nervous system is functioning, if your chi is balanced, if you have good nutritional support, your body can handle it. Is amazing. It can handle anything. Guys, people recover from crazy stuff every day who don't die and thought they were going to die. We are immaculate is what we can do. And we also are very gullible in what we think. So we have to make sure that we support ourselves the best way that we can. And that's why prevention is the best medicine. Doing all the right things, eating right, exercising, sleeping. Yes, you can dabble in certain things like, sugar days, like Thanksgiving and Christmas and New Year's and Halloween and all those things. But the exceptions are not the rules. Just make sure that you're doing things to support yourself, and you can only control you. Just know you can only control you. You can't control others. So support and love not only yourself, but others as well. And if you're not comfortable going out, don't. If you want to wear a mask, do.
But
it's okay.
Well, that's really well said. And I agree with all those points, Tisa. But the point that people are making is that we all need to do it, or it's not going to work. So what needs to be known is that there is no scientific support that the stronger lockdowns have done anything different to inhibit than like Sweden, that very, very light restrictions. So that comment, like 243,000, we need to wear masks. There's no proof that wearing masks does anything to stop the spread, or that social distancing. There's no data to back that up. There's only presumption. And we are going on somebody's presumption. And so I think that that's important too. It's not like we're saying, we are promoting the lie that it's been proven that if we do these things, we'll slow down the spread of the virus, and it has not. There's no proof of that.
Yeah,
None.
in fact, it's almost opposite of that. The
Yeah.
heaviest lockdowns have haven't done anything there. It's almost the opposite. So, and it's kind of a little bit of a dangerous thing to think of, like, I should compromise my health for the good of the all, is a very dangerous thing. And that's where, when you're getting into mass vaccinations, because it's the same concept. It's like, well, you should get this vaccination for the good of all. You should just bite the bullet and do it. You should wear a mask if it's unhealthy for me. And it is, it does. There's so many health issues that it can create, not only physically, but psychologically, that we should do this for the good of all, when there isn't even any proof that it is for the good of all. But it's just a dangerous road to go down. And I agree with Tisha. It's like, do what you think is right. Do your research. It's when you start getting into the thing where you have public shaming or government mandates on personal health. It's a very, very dangerous place to go. I don't, people should really be aware of that fact, that it's because once you go there, it's hard to come back. Once you give up rights, it's hard to get them back. And, so I see it as a little bit of a chipping away of that. They don't do it all at once, because then everybody would be up in arms. And if they do it little by little, then we're kind of okay with it. Some people, I'm not okay with it, but.
Gene, the chipping's been going on for a century. This was like a big chunk. This was
Right.
one big chunk.
Well, we
Right.
think our problems were born yesterday, like, oh, COVID just happened. Well, how many things, like, didn't this all start with the Patriot Act in 2001?
Yeah, well,
know?
we're,
Yeah, I'm just
be
saying.
getting more into political conversation there,
Do
but
your
absolutely.
research. Do your research.
I had a
Yeah,
thought.
because it's all connected.
I was in the grocery store, and I was just thinking, I wear the mask because you have to, because it's for the good of everyone, right? And you are wearing a mask, and I'm looking around, and like, it occurs to me that I truly believe most people around me did not feel like they wanted to wear a mask or feel like it was necessary. And so we're all wearing masks, and none of us, because we think the other person wants us to wear a mask, but in actuality, none of us actually care or think it's important. And it reminded me of just that experiment where you have, like, the monkeys press the lever and they get shocked. And so they just stop pressing the lever, and then they disconnect the shock from the lever, but they never press the lever again. And it's like, it gets to this point where we're all doing something because we think the other person wants us to, or for whatever reason, but we don't actually believe in what we're doing. And then it's just like we're being ruled by something that we don't even believe in the end.
Well said. Well said. Yeah.
Yeah.
And I don't know, again, I'm not sure it's for the good of the all, but you walk into a business, and if that business as a private business has a rule, then you have to follow that rule because it's a private business.
Mhm.
But I think having awareness publicly of these things is important, so that because that's what really drives all this anyway. Because if public opinion and public awareness of what's really happening is there, then they're not going to accept mandates and stuff from the city council and all that. And I think that's what that, the organization of riseupnh.org is about. It's just, getting critical scientific information to people so that they can make decisions based on that, not based on their fears that are unfounded, really, that the news media, which is just, it's become a joke lately, is pushing
Lately?
out there with an agenda.
Yeah.
Well, lately more so. I mean, I've known
Yeah.
it for a long time, but certainly.
Yeah. Well, yeah. Last year it was all about chickenpox, right? No chickenpox this year.
Well,
Because
every
nobody had
year it's
chickenpox.
something different.
Right.
know?
There's got to be
We were
some
all
kind of a thing that we have to
measles,
fear.
What, 2018?
Yeah.
So it's always going to be something. The question is, like, what is the next major distraction for us to, keep living in fear? And we can choose to do that or not do that. And it's again, going back to what is what are we grateful for? What are we looking that is working instead of not working? And so, you know, you can look at the numbers and you can freak out about that, or you can look at the possibilities of what is happening and how many people aren't dying, because we don't hear about the deaths anymore. We hear about only the cases now, because it's the next distraction. It's the next thing to get you to continue to perpetuate what is going on. So we got to really focus, and like Jean and everybody has been saying, you got to do your research, you know, and again, do what you feel is comfortable. Just don't put it on somebody else, because that's not fair. It's just not fair. And just, you have to be compassionate. You have to bring the compassion back to humanity, because covering your face and not seeing people, I mean, I don't know about you, but when you do see a face, you're like, oh my gosh, you're so beautiful and you're so cute. And you're like, oh my God, I like some patients, I haven't even seen their face yet. And I was like, oh my gosh, you're so cute. We are beautiful, and we're just, you know, and kids so confused, you know, and businesses are being affected, I know, and we're all being affected in some shape, form, or fashion. It's just, how do you want to keep living through this, you know? It's really an important question to ask.
I think with that, we have reached our limit for this
Awesome.
webinar. Yeah.
Yeah. Thank you everyone who commented, and Alexa,
Larissa, thank you.
and Larissa. We appreciate the comments and opening up the discussion. Thank you so much for that, for your input. And thank everyone for watching and tuning in. And what's our schedule here coming up? I think we should let people know.
Next week, and then Thanksgiving week we're off, and then we'll be back the following week, and then we'll skip a week, and we're doing that through the holidays. It'll be every 2 weeks through till January.
Okay, so we'll be back next week.
Yes.
More interesting stuff.
Oh yeah.
Right.
Yes.
Yeah. Let us know if you have any other questions or topics. We love to hear about them and talk about
You
them.
can post them on the Proactive Health Collective Facebook page or on the YouTube channel. We're always here to support you and guide you in whatever way we can.
Have a great week, everyone.
Have a great weekend.
Bye.
Bye.